Dear to the examiner, my name is Nurul Ainabila binti Zaidin and my matrix number is 76415. I am the first presenter for Group 9. Before I start with the introduction for this presentation, I want to share a quote by Pat Conroy that I found interesting to be shared here. He said that every industry is going to be affected by the aging population. This creates tremendous opportunities and challenges. Within the context of this country, the growing population of elderly led to many challenges in every aspect, but it also reflected the remarkable improvement of public health programs and economic and social growth in Malaysia. We will move on to the introduction of this presentation. Based on an article on tackling the challenge of the aging society, the authors define aging community as a term that refers to the rising median age of the society as a result of declining fertility rates and mortality rates. In Malaysia, the number of elderly is keep increasing. Based on an article from the New Straits Times, the chief statistician stated that the number of people aged 65 and above increased from 2.26 million to 2.37 million within the same period of 2020. In general, Malaysia is a developing country, so the death rate in Malaysia will keep decreasing every year. It shows that the public's health and status and quality of life in this country have improved. There are various factors that can affect the aging community, such as socio-cultural issues and cultural change issues. In this presentation, we will focus on the environment, lifestyle, and disease, which will be discussed by my other team members. Other than that, if the aging population keeps increasing, it will result in other problems. For example, based on an article by Christia, the healthcare system can be imbalanced due to the demand for health services and care for the elderly, causing social and economic changes in our country. Thus, the aging population can influence Malaysia, especially in nursing practice and healthcare in the next couple of years. I think that is all from me. Thank you, and I want to pass this presentation to Nur Shazwani.
Hi, I am Nur Shazwani binti Ahmadullah with matrix number 76322. I'm going to present about the factors how it will affect community in Malaysia. The first factor is environment in rural areas. Rural areas face disproportionate challenges arising from an aging population compared with urban areas. There are many challenges, especially true for the rural elderly, including healthcare, transportation, social isolation, and financial insecurity. The first one is healthcare. Elderly often get sick and they have higher levels of needs for medical and mental health care. Lack of healthcare professionals, no full-time physicians, and increasingly no hospitals or even clinics is hard for rural elderly to get the treatment. Rural areas have always having inadequate amount of medical equipment than urban areas. The quality of treatment in rural areas is lower than urban areas. Transportation. They may lack access to a personal vehicle and therefore need to rely on someone. Although adults may experience visual and mobility impairments that impact their ability to drive or use public transportation services, this impacts health and well-being due to missed healthcare appointments. Lack of sidewalks and paved roads also limited public transportation in rural areas. Is difficult for elderly to move around. Another factor is social isolation. It is very hard for older adults to maintain social relationships, and it is also addressed loneliness among older adults. Older adults face unique risks of social isolation and loneliness owing to the factors including retirement, losses of spouses, and other loved ones. Last factor is financial insecurity. Most elderly lives in the rural area have a burden to pay the cost of their house as they have no job. They have to limit their financial and might need basic saving services and to cover production costs and emergency expenses. Financial issues cause them to limit their food supply as they don't have enough money. Urban aging is an emerging domain in social and health sciences with implications that reach far beyond the borders of these disciplines. However, there are many challenges of aging community influence the environment in urban areas. For instance, pollution. The anthropogenic sources of pollution such as factories, industries, and transportation that are typically exacerbated in cities due to the local concentrations of human activities. This will cause health problems in elderly such as respiratory issues, diarrhea, and more. The next one is safety. It is that the elevations of crimes, kidnaps, theft, murders, and hijacking is high in urban areas. Older adults can be vulnerable targets to wrongdoers with ill intentions even in their own home, especially when a senior is by themselves. Elderly might cause falls when living alone and lead to injury. Falls are leading cause of injury among adults 65 years old and above, and also many of them take place in a person's own home. The next one is homelessness. Most homelessness is from older adults that live in street or abandoned houses. The causes of homelessness is unemployment, low income, and domestic violence. The majority of the homeless in Malaysia are the members of the workforce who do not have access to a sustainable source of income to afford a place to live. Last but not least is overcrowding in urban areas. Household crowding because lack of space and much smaller overall than houses in rural areas. Some research finds that crowding produces higher levels of stress, depression, aggression, and crime. That is the end of my part. I will pass these presentations to the next presenter. Thank you.
Greetings everyone, my name is Nur Shafika binti Abdul Muin and my metric number is 76399. I will present on the second factor, which is lifestyle, how it can affect future Malaysia. Certainly, we cannot change our genes or much of the environment around us, but making educated and intentional choices when it comes to diet, sleep, activity, smoking, and alcohol use can reduce health risks and potentially add years to our life. Lifestyle is an essential factor in health. Young people nowadays has met unhealthy lifestyles as the dominant form of lifestyle that can lead to illness, disability, and even death. Examples of modern unhealthy lifestyle are unhealthy diet, lack of sleep and exercises, as well as uncontrolled alcohol intake and smoking. So let's look at the first aspect, which is balanced diet. A healthy balanced diet can help provide energy and lower the risk for the leading chronic diseases such as heart disease, hypertension, diabetes, and cancer. It also can help to maintain a normal weight. Certain diseases and conditions have proven relationships with specific nutrition and dietary elements. Next is an adequate sleep. A good night's sleep is important for all of the metabolic function required by the body, such as regenerating old cells, repairing cell damage, and getting rid of waste. Then, an adequate exercise. 30 minutes a day of regular physical activity contributes to health by reducing heart rate, decreasing the risk of cardiovascular diseases, and reducing bone losses which are associated with age and osteoporosis. At the current time, lack of exercise is thought to contribute to 9% of breast cancer and 10% of colon cancers in Europe. And there are many aspects that play a role in our lifestyles, but these three are the most important. Healthy lifestyle should be accustomed since our youth because the consequence not only involve ourselves but also many people from various sides, such as the country's economy to decline is high due to lack of efficient workers. Social isolation occurs due to lack of interactions between communities, and lastly, a person with a chronic illness is more likely to experience depression. That's all from me, and now I will transfer you to Nur Ain binti Ambosaka.
Good day to the examiners. I'm Nur Ain binti Ambosaka, ID number 76331, and I will be presenting to you about how aging community affect Malaysia, especially in healthcare. As we all know, the elderly are less healthy than the youngs. Hence, an increase in the proportion of the age group is associated with an increase in the prevalence of ill health. Multiple pathologies resulting in multiple systems are a common phenomenon in the elderly. We can take an example for a disease called Alzheimer. This is a common problem afflicting the elderly and is estimated to affect at least 5% of the population aged 65 years and above. The number of this disease is expected to increase with the rise in the number of elderly population, and this has important implications on the country's resources of medical care. The elderly with their chronic diseases and problems require long-term care, while in healthcare system in this country is primarily geared towards short-term care and hospitalization. Thus, the present healthcare system is thus inadequate and even inappropriate to service the elderly with their chronic diseases and disabilities. As the proportion of the aged population increases with time, the ratio of people working to those retired is expected to fall. This will lead to a shortage of workers. With regard to prevention of diseases and disabilities in the elderly, the early prevention should be taken. Healthy lifestyle promotion will benefit as a healthy young adult will normally continue to become a healthy elderly citizen if the healthy lifestyle practices are continued. This will minimize the incidence of illness and disabilities in the later years. That's all from me. Thank you for listening. I will pass this presentation to the next presenter. Thank you.
Assalamualaikum and hi everyone. My name is Nurin Erdina binti Muhammad Rizwan and my metric number is 73745. Today, I will present about the implication to nursing practice and healthcare. The relevance of social sciences in nursing. Firstly, the social sciences can potentially facilitate reflective practice, thus helping nurses to more confidently challenge ineffective or suboptimal practices. Secondly, the social sciences have demonstrated the importance of user participation and inclusion of student nurses will not only capture their perspective but also provide a model for the development of nursing curricula. Next is the implication to nursing practice and healthcare. First is the demand places on the healthcare system in the future. As we know, older adults have different healthcare needs than younger age group, and this will affect the demand places on the healthcare system in the future. Older adults are more likely to suffer from chronic illness, for example, cancer, heart disease, and diabetes, than the younger people. Next, nurses must be aware of the aging phenomenon and related concerns such as physical, economic, and psychological changes that occur as people age. Knowledge of physical and psychological changes that occur with age is important. Last but not least, it can increase risky health behavior. Ageism also increases risky health behavior such as eating an unhealthy diet, drinking excessively or smoking, and reduce our quality of life. So that's all from me. Thank you.
Greetings, my name is Nurhanisa binti Muhammad Hassan Rose, and today's presentation will help you to understand how aging population would affect Malaysia in the future. First and foremost, how exactly Malaysia determines their number of population. Malaysia established a federal organisation, namely the Department of Statistics Malaysia, in year 1949. The Department of Statistics Malaysia is a premier government agency responsible to collect, interpret, and disseminate latest and real-time statistics in the monitoring of national economic performance and social development. Now that we discuss how Malaysia is establishing their demographic, economic, and social data, let's consider some statistics to gain a better understanding of this service population. year 2016, the Department of Statistics Malaysia released their population projections in year 2010 to 2040. According to them, Malaysia was estimated to experience 7.2% of population that aged 65 years and above by year 2020. However, in year 2020, the prediction wasn't fully achieved, but Malaysia did hit closer percentage, which was at 7.0% of population that aged 65 years and above. In the recent statistic, which in year 2021, the percentage of the population that aged 65 years and above has increased about 0.4%, which sums up the total of 7.4% of aging population in Malaysia. Moving on to the next presentation, why the percentage of aging population keeps increasing throughout the years in Malaysia and how. The increased percentage of aging population are mainly influenced by increase in life expectancy, low or declining fertility rate, and migration. The increase in life expectancy is due to improvement in a healthy lifestyle, such as having good sanitation and hygiene, while the low or declining fertility rate is due to late marriages, the high cost of raising children, and the preference of the couple to not have children. This is a quote that I have retrieved from Google. According to Toshihiko Fukui, the aging and declining population will have far-reaching impacts. Declining fertility rates will possibly increase immigration. Thus, the structure of the family and society will inevitably change. Now, question to consider: what is the relation of these 65 years olds and above population to our future, and why it matters? Let's look on to what will happen to the aging population in the future. According to Wan Muhammad Suhairi bin Wan Ibrahim et al., in year 2017, children make up less than 1/4 of the total population, which is 24.1%, while those aged 65 years and over comprise 6.2% of the total population. In addition, they also estimated Malaysia will have nearly equal share of the young population, which is 18.6%, and older population, which is 14.5% in year 2040. By this time, there will be 3 older persons for every 20 population. This prediction will further give negative impacts toward Malaysia, such as increase in dependency ratio for elderly, increase in demand for healthcare and social services, and have a greater risk for economic depression. As aging population keeps increasing over the year, the Malaysian government are legally obligated to ensure accessibility for older people as they need more assistance on contrary to other age groups. Now let's move on to the last slide, which is conclusion. In conclusion, aging process are strongly influenced by environment, lifestyle, and disease. The study of social science is essential, and it must be utilized and demonstrated by the nurses through nursing practice and care. Nurses must be aware of the aging phenomenon, and they should prepare mentally, physically, and psychologically when assisting elder patients. The demography of aging population in Malaysia increased significantly throughout the years. Life expectancy, fertility rate, and migration affected the increased number of aging population. And last but not least, Malaysia will achieve the same total population of younger and older population by year 2040. That's all from me. Thank you.